Hello, welcome to my channel. Today I'm going to discuss about one small topic about vasculitis. So, systemic vasculitis. I'm not going to go in detail because I'm going to mainly cover about only one topic, that is giant cell arteritis. So this is a case scenario. I would like to point some points. There is a 70-year-old woman. So you have to look at the age. It's a 70 years, it's old age, and she's a female. She came to the emergency department with no red flag symptoms. That means like fever and other problems. Her vitals are normal, and she has some tenderness over the left temple. Her visual acuity, feels, and the rest of her exam are normal. So only she has problem with left-sided headache. Okay, and we managed to do the CT scan for the lady, and her lab marks are noticeable, and ESR of 41 is elevated, and the ibuprofen was prescribed before for her headache. But she got relieved, but this time she came to the emergency department 2 a.m. and the scalp tenderness was present. And do you consider giant cell arteritis? So let's see whether how to diagnose this case and whether we are going to refer this patient for the ophthalmologist or not. So this is a CT image of for the particular patient, and you can see the granular matter changes, and because of the granular matter changes, the artery is narrowed, and because of this there is a lack of blood supply. So we will see in detail what is systemic vasculitis. So we know it's a heterogeneous group of disorder, and it's inflammation of the vascular wall, and depends on the inflammation morphological changes. The clinical manifestations will be present, and size, location of the affected vessels, as well as the activity of systemic inflammation. So altogether, I can say it's a heterogeneous group of disease, and main morphological sign is inflammation of vascular wall. And if you look into this clinical classification of systemic vasculitis, it's very broad, and there's a lot of types. So I would say there's a large vessel vasculitis problem, medium vessel, and a small vessel vasculitis problem, and depends on the sizes of the vessels, what type of vasculitis can happen. So it's some kind of classification. Then main forms of systemic vasculitis is large caliber vascular lesion. That is mainly it affects aorta and major branches. And you can say giant cell arteritis and granulomatous arteritis is one of the type. And the arteritis Takayasu, you know, this arteritis is diagnosed in Japan. That's why this Takayasu name has been given to this condition. And medium vessel, some important types of polyarteritis nodosa, Bayerger's disease, and Kawasaki's disease. Small vessel vasculitis, there's some other examples also here. And giant cell temporal arteritis is also known as temporal arteritis. You know, this is very common in the old age people, and which is affecting the superficial temporal artery. And women are more prevalent for this disease when compared to men. What kind of symptoms can you see if a person has this kind of temporal arteritis? First thing is ischemic syndrome. You know, there's a granular matter changes. Because of the granular matter changes, the narrowed vessels, it will narrow the lumen. So because of that, the blood supply will be reduced, and there's a non-infectious immunological mediator process happening here. That means it's not infectious, it's immunological mediated process. We should understand this one. And headache, most common symptoms, and jaw claudication. You know, jaw claudication, why is it happening? Because there will be a low blood supply. Because of the low blood supply, the people has difficulty in opening up the mandible or jaw. Inflammatory condition Also accompanying this most common inflammatory condition is polymyalgia rheumatica. It's not a rheumatic problem, it's considered as a polymyalgia rheumatica. That means like inflammation joints. Mainly it happens in the shoulder and the hip. So that's called polymyalgia rheumatica. And the giant cell arthritis is most feared for its potential to cause monocular binocular blindness. So this blindness is very severe complication of this disorder. Once the blindness has developed, you can't reverse this condition. And ocular complications, as I said, is giant cell arthritis. There will be a transient monocular visual loss and also visual loss due to central retinal artery occlusion. Visual field defects will be present. And there's some kind of classification to find out the criteria. It's given by American College of Rheumatology. They are saying that if you want to classify this criteria, 3 out of 5 criteria should be present. Age should be 50 plus, new headache. That means headache should be like new pattern, new type of headache should be there. And temporal artery tenderness should be there, and decreased pulse. ESR should be more than 50, elevated, or positive biopsy. If you do the positive biopsy from the temporal artery, then it should be positive. So this is some kind of criteria. How will you diagnose? Main thing, you have to go for biopsy. Okay, at least 1 centimeter, there will be patch type of granulomatous change. 1 centimeter gap, then there will be change, then gap, like that. So there will be increased ESR and increased total leukocyte count, and granuloma formation will take place. So what is the treatment for this condition? Purely steroids. So patients without visual defects should be started 40 to 60 milligram of prednisolone daily. Or you can go for methylprednisolone for 3 days intravenous injection. Then you can change to oral. Thank you for listening.